Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Wonderful. I need to do some range of motion exercises on your left shoulder. Is that okay?
Yes.
Let me close your privacy curtain and wash my hands. I'll be right back. Okay, Mr. Jones, the first exercise I'm going to do is bring your arm above your head and back down to the bed like you're asking a question. I'll do all the work. All you have to do is let me know if there's any pain or discomfort as we do this, okay?
Okay.
So we're going to bring your arm all the way up, supporting at both joints. Slowly and smoothly, all the way back to start. Here's one. We're going to do that 2 more times. Up, still okay?
Yes.
Back to the bed, and one more. Up, and back to the bed. Okay. The next exercise we're going to do is bring your arm out and back in like you're making a snow angel. Okay?
Okay.
So I'm going to support at 2 joints. We're going to go all the way up and all the way back to start. Feel okay?
Yes.
All the way up and all the way back to start. Still okay?
Yes.
One more. All the way up and all the way back to start. Good?
Yes, ma'am.
Are you comfortable?
Yes, ma'am.
Would you like a magazine before I go?
No, thank you.
Your environment is clean. Bed is in the low position. Let me give you your call light. Here's your call light. If you need anything at all, just press that red button. We'll be happy to help.
Thank you.
I'm going to open your curtain and go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done.